Morning, everybody. My name's Gina Haney. I'm an account manager at Infinity Benefit Solutions, and today I'd like to update you on some dental and vision updates as going with COVID-19 currently. So we'll talk about some dental updates, we'll talk about some vision updates, and then we'll open it up to any questions that you have. So for dental, things have changed. So remember, as you make your appointment, they're going to ask you if you currently have experienced any symptoms, any things that may be related to COVID-19. So they'll most likely ask you if you've had any fevers, coughs, or if you come into contact with anybody who's had the illness. And then your dentist will decide if you can come safely into the office. So if you have experienced any of these things, then most likely you'll need to reschedule. They're going to ask you to wait in the car. Typically you'll call in and they'll give you the thumbs up to come in. Usually it's just going to be yourself. For instance, if you have a child that can go in by themselves, they'll most likely just have them go in by themselves. And many of the offices, most of them will require you to wear a mask. So bring one along. Obviously right now, you definitely have to do that if you're indoors. One of the things you're also going to see is that, dentist offices are very famous for having tons of magazines and things for you to read while you're waiting. Those have all been removed. The staff's going to be wearing additional protective equipment. They're going to have face shields on, masks, gowns, head coverings, things of that nature. The treatment is been modified to reduce the amount of aerosols. So for instance, a hygienist may hand polish your teeth instead of that ultrasonic cleaning. So they're going to do some different things there. And just remember, your appointment is probably going to take a little bit longer than usual because of all these strict guidelines, and they have to do extra sanitation and other measures. Most likely it's going to take a little bit longer. And one thing to note is you're not going to get charged any additional fees because of the PPE that they're using or the infection control procedures. An update from Delta Dental was that you're not going to get charged on these things. They're considered part of and included in your fee for that complete service. So just keep in mind you're not going to see a bill separate to that. So that's very good to know. And teledentistry, just like we see in the medical, is an option that's also covered right now with Delta Dental. So providers will use tools like FaceTime or a video chat to evaluate a dental problem remotely, rather than requiring in-person dental office visits. So if there's something, not of an urgent situation, most likely you might be able to handle that on a FaceTime. You can contact your dental office directly to determine if they would offer those solutions to you. Most of the time, you probably are going to have to go in. It's kind of an odd, a little different. But if you're experiencing some pain or some things like that, the teledentistry might be a good option for you. And then with vision services, eye doctors, those offices are back up and operating. But of course, they also have increased safety and sanitation protocols that they're following too. There's really no in-home solutions available for eye exams. That's definitely something that you typically have to go in for. It's hard to evaluate over the phone. So, usually they will still require that office visit. And there might be options where you can still get glasses, lenses, or contacts if you can't leave your home. So for instance, if you need another pair of glasses and your prescription hasn't changed, that's something that you can take care of without having to see you. Oops. Sorry. Okay. Technical difficulty there. Hold on. And then many doctors will have revised procedures for you to follow, like filling the paperwork electronically ahead of time. They may send it to you over email for you to complete that. Or again, you're going to wait in your car. Once you get there, you're going to check in and tell them you're there, and then be able to go in at that time. So if you have questions, definitely just call your doctor prior to the appointment, and they'll give you instructions on how to prepare for your visit. And you can also inquire about how they're safely going about seeing you. So in conclusion, just remember now that these services are open back up, they're critical components to your overall health. Dental and vision sometimes can identify some medical things that are going on with you. So they're definitely critical components, and you do need to still go and see these providers. So keep scheduling your appointments, ask about their safety protocols. If you feel uncomfortable, you can, reschedule. Everybody's being very flexible with these services. So keep making the appointments. And at this time, if you have any questions, or if you have questions after the presentation, my contact information is here, my phone number, email, so please feel free to contact me. We're here to help and answer any questions that you have. Thank you.